Hello everyone, I am melani, Counselling Psychologist and Therapist. I am affiliated with Basilmind to talk about the most indispensable topic, that is stress. In our last segment, we have completed what is stress, how stress occurs in an individual's life, what are the types of stress and kind of stress. Today in our segment, we are going to cover about the clinical features of stress. Now we all know what stress is all about. Now to understand whether we are going through stress or not, it's an important and a crucial question mark. Now in order to answer this, let us understand what are the clinical features and are we going through any of these aspects in our life. To understand this, let us divide the clinical features in 4 aspects. Number 1 is cognitive, second is physical, third is behavioral, and fourth is emotional. Let us understand one by one. The very first is cognitive. So what happens in cognitive clinical features of stress? An individual is going through a constant, irrational, faulty, negative thinking. So an individual is not able to understand and rationalize anything. The person has a heightened level of negative thoughts. Also, we can see that one of the biggest clinical feature in this cognitive aspect is that one person is not able to keep anything in their mind. It's just that there's loss of memory and there is a high level of forgetfulness. For example, if someone has gone through a major stress, be it acute, episodic, or even chronic, they are going through a tendency of forgetfulness. So what happens over here is that they are not able to remember a lot many events, situations, and any particular thing that is supposed to be remembered. So there is loss of memory. For example, have you seen that in any of your experience when you're talking to somebody and telling them that I have shared this important information with you, and another person is not able to remember and recognize and able to recall that the person has shared some an important document with me. So it is important that an individual understand that there is a lack of memory. The people are not able to remember much. There is forgetfulness. Another aspect is loss of attention, and a person is not able to give their focus and concentrate in any particular thinking. Also, there is loss of judgment. When an individual needs to require a full attention span and able to make a good decision, they always lack. It wasn't there before in their life, but because of certain situation and event which has happened in past or maybe in at some other levels of their life, they are not able to make a good decision. Imagine yourself to be stuck in particular situation. Back then you were good in making a decision and you were able to take that high level of risk and produce a good outcome, but when you are stressful, you are not able to decide what to do, what not to do. You are actually confused and you are puzzled. You are all the time baffled. What is going on? How do I solve this situation? You need another person's help. You're not able to work at your optimal level of functioning. So there is loss of judgment too. So in this way, we have covered what are the cognitive clinical features of stress. Now let's quickly and swiftly move on to what are the physical symptoms and clinical features of stress. Mainly people have a constant level of nauseation, or they have upset of bowel, and maybe they are going through a high rate or high elevated blood pressure they are having. It seems that many people have constant level of backache or muscle pain, or they have one or another physical problem, just like high level of sugar, blood pressure, etc. So all these things are physically seen in their body. At times it may so happen that an individual is going to urinate time and again and have a bad appetite, or maybe they are going through a lot of changes in their physical life. Also, we can add on many things to it. You can see that person has a chest pain or maybe a very bad backache. So all this will include in the physical symptom, physical clinical features of stress. Now let's quickly move on to emotional aspects of stress. An individual is always feeling like, he's depressed or she is going through high rated of elevation, and they are not able to understand how things are going, so they're emotionally not stable, and they are always having two moods. They don't know what to do, they don't know how to react to a particular situation. Back then it was very cool, it was very calm how to react to a particular situation. Rather than reacting, we knew how to respond to situation. But when you are accompanied with stress, you don't have that particular ability to perform yourself to actually give yourself your identification or to talk to person in an optimal level of functioning. You just reduce that. So emotionally you always feel negative, or maybe you feel depressed, you feel there's a high level of anxiety, there's a constant level of worry that is going on. You're always thinking about what will happen tomorrow, how will I deal with any situation, and there's a lot of irrational faulty thinking which is going on. There are a lot of mood swings. It may so happen there's a feeling of melancholy. You don't know why this is happening to you. There's no such a particular reason as to why you're behaving like that, or why you're so sad. You're not able to feel happiness. You are not able to feel that pleasure out of anything. Every time you try to do something which you feel that that will make you happy, you are not able to achieve that pleasure, the amount of happiness from that particular event or that particular situation, or by doing or performing certain act. Also, it may so happen there will be a lot of changes that you can see emotionally. Now let's talk about behavioral changes. What will be the behavioral changes? So the very first thing that comes in behavioral pattern changes is that an individual tends to overeat or doesn't eat at all. So it may so happen that a person loves to eat chocolate when they are stressed, or they eat a lot of cupcakes, or maybe something which is very oriented and have a high amount of sugar in it, we can say that. So they love to eat a lot, or they have loss of appetite, they are not able to eat anything. Similarly, in their behavior pattern, it can be seen that to cope up with stress, they use wrong and negative defense mechanism. Either they start smoking, they start taking drugs, or maybe they have nail biting issue. Everything, all these are behavioral issues. Now you can see that there is a constant change in their behavioral pattern. Before that they were never doing nail biting, but now to cope up with stress, they don't know how to cope with up. So the body chooses a different defense mechanism, which other person thinks that it's cool to do it, and body doesn't know how to operate on that particular thing, how to operate and how to reduce the level of stress. So the person starts smoking or have anything which is considered to be unethical or not good for your body. Also, one thing which is widely seen as a prominent clinical feature, that is loss of sleep, or there's a wrong sleeping pattern. It may so happen an individual is unable to sleep because in your mind you're constantly worrying about something. So how you will sleep? Your brain will never shut off. Your brain requires at least good 6 to 7 quality of sleep. It is unable to sleep because there's a lot of irrational and faulty perspective thinking is going on. Another clinical feature of stress is low libido. A person may have low sex drive or not able to reach to orgasm. It may so happen that people have erectile dysfunction. Also, it is usually seen that the menstrual cycle may be shorter or maybe for longer days. So we have covered the behavioral, the cognitive, emotional and physical clinical feature of stress. I hope you enjoyed as much as we enjoy making videos for you. Stay updated, and to know more about stress, keep watching.